This video tells you what you need to know about methotrexate, which is used to reduce inflammation and therefore reduce any long-term damage to your body resulting from this. It will also reduce swelling, heat, redness and pain. It can be used in combination with other disease-modifying drugs, including biologics. Methotrexate can be taken as tablets or an injection once a week. It is never taken more often than once a week. You should be supplied with 2.5 milligram tablets. Take the correct number to make up your prescribed dose all at the same time with food. Check you have been supplied with the correct strength tablets, as 10 milligram tablets are also available. Injections come in a pre-filled syringe, which is injected under the skin and can be given at any time of day. You will also be prescribed a vitamin called folic acid, which reduces the risk of side effects. The prescription strength tablets are a higher dose than what you can buy. Folic acid is usually taken the day before and the day after the day of taking the methotrexate, although other regimes are sometimes used. Do not take it on the same day as methotrexate. It may take 12 weeks to see improvements in your symptoms. You will need a chest X-ray before starting treatment. This is routine investigation for this treatment. We may arrange regular lung function tests. Blood tests checking the liver, kidneys, blood cells and level of inflammation in the body need to be done before starting treatment. Then every 2 weeks for the first 6 weeks. Then once a month for 3 months, then once every 3 months. Regular monitoring is important for your safety, and treatment may be stopped if it is missed. Some people experience mild nausea, diarrhea, mouth soreness or ulcers. These symptoms often settle with time and with the use of folic acid. Occasionally, people develop severe nausea, headaches, dizziness or feel generally unwell, whilst others may develop a skin rash or mild hair thinning. Some people find they experience mood changes, such as feeling flat or moody. And more rarely, methotrexate can reduce the number of blood cells you produce or affect your liver function, but this will be picked up with the regular blood tests you have. Methotrexate can make the skin more sensitive to the sun. Take precautions to prevent sunburn, such as using sunscreen and keeping skin covered. Other side effects where you should stop taking methotrexate and seek advice are the whites of the eyes turn yellow, dark urine, infections other than a minor cough or cold, severe sore throat, unexplained bleeding or bruising, mouth ulcers, blood in the urine, severe vomiting or diarrhea where you are at risk of becoming dehydrated, or a rash. If you develop breathlessness and a dry cough and fever, this might be a sign that the lungs have become irritated. Seek advice if you need to have surgery, as you may need to temporarily stop methotrexate. Taking methotrexate can make you more susceptible to infections. You should avoid contact with people who have chickenpox or shingles until their blisters have healed. Contact your doctor or the rheumatology team as soon as possible if you are not already immune and you have come into contact with someone with those diseases. Methotrexate is not a painkiller, so you can continue to take painkillers with it. Anti-inflammatory painkillers should only be taken on the advice of a healthcare professional. Do not take the antibiotics trimethoprim or cotrimoxazole, which is also known as Septrin, when you are on methotrexate treatment. Methotrexate can interact with other medicines, so do not start any new medications without discussing with the doctor, nurse or pharmacist first. You should have the usual recommended pneumovax, yearly flu vaccines and COVID boosters when appropriate, as well as the non-live shingles vaccine. Avoid live vaccines such as yellow fever or rubella. Avoid alcohol altogether on the day you take the methotrexate and keep your overall alcohol intake under 14 units per week, but ideally less. Methotrexate should not be taken by women who are trying to conceive, are pregnant or breastfeeding. It is essential to use reliable contraception whilst taking methotrexate. For men, there is no need to stop methotrexate before trying for a baby. As with all medicines, you should store them out of reach of children. If you have any other questions, you can contact the rheumatology team by phone or email.